Hi, this is Dr. Kevin Tomassini from Span and Performance here at Core Collective, and today I'm with Hashim, and we have a story for you. Okay, so Hashim, what were your symptoms when you first started chiropractic?
About 3 years ago, I have a lower back pain. It radiates to my leg,
Okay.
and I lead an active lifestyle, but because of the pain, I can't run. And last year, I have a back pain, neck pain.
Okay.
It radiates to my fingers, and it's always tingling and numbness. And
And before that, do you have any treatment? Do you have went to?
yeah, I do. Went to a few doctors and physiotherapists to do exercise, and I depend a lot on medication.
Well, a lot of medication.
Painkillers.
Painkillers. How many medications you were taking?
About 3 or 4.
And did that help, or how was it?
Occasionally, yes, but it's just that I felt I shouldn't be depending on it.
Okay.
You know.
Yeah,
So,
of course.
Yeah.
And so I remember that we met in MediaCorp. We met in a talk that we were doing about posture and ergonomics.
Yep.
And then you came to the office and you started the treatment. We have done like probably 10 sessions, right?
Oh yeah. By today, I think we have about 10 sessions, and I feel fine.
Good.
And last weekend, I managed to do what I didn't manage to do for the last 3 years running, and I did completed a half marathon.
Nice. You have the.
This is the medal. I completed the run without any pain.
Good. That's what chiropractic can do for you, and exercise, because it's really important that you've been consistent with the adjustments, you've been consistent with the exercise, and that's why you're seeing results. So that's actually really good that we can help, and glad that you're here. Thank you.
Oh yeah. For those of you who have the same symptom like me, I really believe you should give it a try. Seek help, seek treatment, manage your pain.
Okay.